Okay, sir. Uh, good afternoon, everybody. I'm Poonam Yadav, research scholar from GLA University, Mathura. My topic of presentation today is pharmacophore-based virtual screening, molecular docking and simulation approach in designing of novel heterocyclic scaffolds having anti-Alzheimer activity. We'll be talking about the molecular targets, advancement, and future possibilities. Next slide, please. Or can I do it myself? Okay. The main purpose of the research is we are in need. Actually, I'm working on Alzheimer. So, as we all know, that Alzheimer is yet proper treatment of Alzheimer is yet to be obtained, as it only provides the symptomatic treatments. So, the research objective, if the current model is, we are trying to construct a pharmacophore model for which is having dual cholinesterase inhibitor activity, that is for both enzymes, acetylcholinesterase as well as butyrylcholinesterase. So we are looking for an compound which will act on both of these targets, and we will look into the virtual binding interactions and stability of these inhibitors molecule computationally, and we'll also look into the in vitro activity of these dual acetylcholinesterase as well as butyrylcholinesterase ligands, which we will obtain later on. Now, the current, next slide, please. The current flow of work is we have taken two targets over here, two enzymes we have taken over here. That is, first is human acetylcholinesterase, and the other one is butyrylcholinesterase. So, can I have the next slide? Excuse me, sir. Okay, I'll continue with my work. The two targets were chosen, and first of all, we did virtual screening using Desmond software. We actually selected the pharmacophore. 6-feature pharmacophore was selected. Then after that, we did the virtual screening. And after virtual screening, we went for molecular docking, then molecular simulation, and in vitro activities were done by PKCSM. The database which I chose for this for this work was Zinc database. So approximately 125,000 molecules were there in the Zinc database, which after virtual screening, 85 and 86 respectively of acetylcholinesterase and butyrylcholinesterase were chosen out. Then out of them, after performing molecular docking, 11 molecules which were having good fit value as well as estimate value was chosen. And then these 11 molecules were then I went for molecular docking of these molecules, and later on molecular simulation was performed to validate this the whole work. Now, the PDB which was selected were 4EY7 for acetylcholinesterase, and for butyrylcholinesterase we had selected 5DYW, and both of these PDBs were selected based on their resolution as well as their R value, which was under the criterias which have been provided by us by the literature survey and all. It was under the resolution, the acetylcholinesterase one was having resolution of 2.35 angstroms, whereas the butyrylcholinesterase was having resolution of 2.50, which was under 3, both of them. And the R value was also proper for choosing this PDB. Then we actually started our work with with the designing of pharmacophore model. So pharmacophore model, it was 6 features pharmacophore model, where the features were hydrogen bond acceptor, hydrogen bond donor, hydrophobic, aromatic, negative functional group, and positive functional groups. They were selected, and the pharmacophore model was designed, which was validated by using the GH scoring method that was Henry scoring method. The acetylcholinesterase was found to be having the value of 0.7, and butyrylcholinesterase was having the value of 0.8, which were both under the recommended GH scoring value. That is, it should be more than 0.5. Then then other next. So can you move this slide to slide number 6? Actually, I've completed this part. Can I get the next slide? Let me proceed with the next thing. Now, when we started with the molecular docking part, where binding energy, of these compounds, these all 6 compounds was chosen, and the binding energy was in the, yeah. So can you please move it to slide number 6? Okay. So, I was talking about molecular docking. Molecular docking, the binding energies were found to be of the zinc compound, the 3 compounds which were chosen. The acetylcholinesterase, the binding energy was minus 98.546 for the molecule 2445. For the molecule having zinc ID 3021, the binding energy was minus 107.213. For the molecule 1938, the binding energy was minus 127. In the same way, for binding energy was find out for the butyrylcholinesterase 1. Now, the Lipduc module of Discovery Studio 2.0 was used for finding out these binding values. Then this was validated using the molecular dynamics. So the reliability as well
Can
as,
you please
as well
summarize in one
as
sentence?
the of the complex was okay, ma'am. So the last summary, I must say that as the RMSD value was under the score of 3.0 angstrom, and the RMSF value was also under the value was also under 3.0 angstrom. So these molecules, they have a potential of producing a good heterocyclic scaffold. So we will be using these scaffold which we have obtained for next synthesis, and then we'll be looking into anti-enzymer activity of these compounds. So that will be all. Thank you very much.
Thank you. Thank you so much, ma'am. Thank you so much, ma'am. Now, as moving forward, I would like to call Neetu MD ma'am for their poster presentation.
Hello, Poonam ji, am I audible?
Yes, sir, you're audible. Should I leave the meeting?
No, madam. I have only one question, that I have chosen only human acetylcholinesterase enzyme, and what was the rationale of selection of that particular enzyme?
Sir, the enzyme was chosen based on the literature survey, and also the PDB, which I have chosen, was having a good resolution as well as R value. So that's
Okay.
why, as for acetylcholinesterase, this PDB was chosen.
So in future, are you using your result for a particular disease that correlated with the acetylcholinesterase enzyme?
Yes, sir. Actually, I'm working on anti-Alzheimer activity. So this acetylcholinesterase as well as butyrylcholinesterase is the target for this particular disease. So the whole work is going on this target. That's why I've chosen these 2 targets.
Okay.
Actually, we have approached the multi-ligand, multi-target approach.
Okay. So, ma'am, my last question is, ma'am, what is the currently good medicine for Alzheimer disease that markedly very popular?
Sir, it's donepezil. Currently, it's donepezil.
Donepezil. Okay, thank you, madam.
Yeah.
Thank you.
Okay. Okay, sir. Thank you.
Madam, next candidate join karo.
Thank you so much, ma'am. Now, are we audible? Neetu, ma'am?
Yes, I am audible. Is audible?
Okay. So, can
My
I-
side is audible, ma'am. Sounds okay.
Ma'am, you can go with your poster presentation.
Can I start, sir? Can I start?
Sure, ma'am. Continue.
Okay. Good morning. Good afternoon. Myself, Neetu. Actually, I am the PhD scholar in Amity Institute of Pharmacy, Amity University, Madhya Pradesh. And also, I am working as an assistant professor in Medicine College, the Pharmaceutical Services, Kerala. Here, my project poster presentation topic is probiotic and nutritional potential of fermented millets food in gut microbiota modulation. We know the millets are is called as Nutri-Cereal. As compared to the other millets, other cereals, millets have a lot of advantages like complex carbohydrates, proteins, and minerals. Because of that, it is called as Nutri-Cereals. Here, while we done actually is the fermentation of the millets. Some of the beneficial happen after the fermentation of the millets. With the help of lactic acid bacteria, yeast, it produced a good nutrients and along with it decreased the anti-nutrient effects. Here, in the picture, it is mentioned that fermented millets, it will go some biotransformation measure like increase the short-chain fatty acids like flavonoids, peptides, antioxidants, and also it inhibits the bioavailability of iron, zinc, calcium, and vitamins. Also, it decreases the anti-nutrients and phytate and tannins. What happened in our gut after having the fermented millets? After having the fermented millets, our the short chain fatty acid like propionate, acetate, butyrate will be increases. It help to our reduce the appetites and it will help to the maintain the weight management and also to help to our reduce the inflammation and very good in cardiovascular and good for our brain health and increase in our gut, it will be increase a good barrier bacteria like bifidobacteria, lactobacillus, and also decrease the pathogens like E. coli and Clostridium perfringens. What happened? What is the physical benefits and the systemic benefit after having the fermented beans in continuous way? Not for the single days. After the continuous having of the millets, it will be have a lot of benefits like physiological benefits and systemic benefits. Physiological benefits like gut barrier integrity and immune modulation, anti-inflammatory effect, and antioxidant. Gut barrier integrity means it will be increase the integrity of our gut barrier, like increase the barriers like only nutrients can absorb and the anti-nutrients it will be stop the barrier. It just be not enter. It will not allow to the anti-nutrients inside our guts, and also it help with the immune modulation. That means increase the interleukin-10 and decrease the interleukin-6, and also anti-inflammatory effect and antioxidant. Systemic benefits like brain health, anti-diabetes, and cardiovascular. Brain and guts are interconnected each other. Like our endonutrient system and the vagus nervous are connected to our brain. These are help to maintain the brain health. If our gut is good, our brain also will be good. Some simple example like serotonin. Serotonin is a neurotransmitter. It will be help to maintain our mood swing in our body because unbalance of serotonin because our gut is very bad condition, serotonin will be reduced or any bad imbalance between serotonin happen, and it will be affect our brain like mood swings, like anxiety, depression, etc. And also inflammations like a neurological inflammation and the neurodegenerative disorders like Alzheimer's also happen because of our gut. Diabetes, because of maintaining the sugar level in our body and also maintain the balanced weight, it will also reduce the diabetes and also very good in cardiovascular support, like reduce the cholesterol level and reduce the weight and also reduce the sugar, and it will be also very good for our cardiovascular. My conclusion is that fermented millets products are sustainable, cost-effective, and healthy dietary solution, integrating the traditional method of fermentation with modern concept of nutrition, which enhance the diversity of gut microbiota, metabolic homeostasis, and overall well-being of humans. Thank you, sir.
Hello. Madam, am I audible?
Yes, sir. Audible, audible.
Madam, I have only one question. Is there any direct correlation between the gut bacteria and the hypertension?
Sir, uh, please tell me, sir, one more. It's not audible. Could you please tell?
Is there any evidence-based study or their direct connection between the gut bacteria?
Yes, sir. Yes, sir. Actually, the
Hypertension.
research articles and publications are available in our one of our professor, Mr. Neeraj Mishra, sir, also published one book regarding the gut microbiota and brain health, sir.
Okay, thank you. Madam.
Thank you, sir. Welcome.
Madam, hi.
Sir. How are you, sir?
Fine. Everything is going fine.
Sir, everything is going fine. Today's Kerala is lot of rain.
Okay. All are good in family?
All good, sir. What about you, sir?
Nice, nice.
Sir.
Okay, bye.
Thank you, sir. Can I leave, sir? Can I leave?
Yeah.
Thank you so much, ma'am. Now moving forward.
Okay. Can I leave from the? Can I
Yes.
leave from here?
Yes, ma'am. You can.
Okay. Okay. Thank you. Thank you. Thank
Thank
you.
you so much.
Now moving forward. Hello, ma'am. Am I audible? Neha, ma'am. Hello, ma'am. Hello, Neha, ma'am. Are we audible?
No problem.
Yes, yes, audible.
Okay, ma'am. You can continue.
A very good afternoon to all high authorities present over here. A very good afternoon to all high authorities and over here. Respected faculty members, I Neha Bandel, research scholar of Amity Institute of Pharmacy, Amity University, Gwalior, Madhya Pradesh. Today, I am here for oral presentation of lactose polymer nanofiber for controlled and targeted drug delivery. So, firstly, I started to share my. So, firstly, I started. Uh, Lactose spinning is a manufacturing technique used to produce extremely high polymeric fibers, typically with diameter in the micro or nanometer range. It involves the formation of electrohydrodynamic gel. The lactose spinning is that the resulting fibers mimic the extracellular matrix, making them highly valuable in various fields. Primarily, the application include biomedical engineering, includes extensively for creating structures for medical use, drug delivery, facility for cell growth and uh, tissue regeneration. Lactose spinning is a superior method for drug delivery applications. High surface area and porosity, lactose spun fibers possess an incredible high fill area to volume ratio and significant porosity. This structure is crucial for enhancing interaction with biological environment and improving drug loading efficiency. We can achieve both localized delivery, specific site, and control sustained release over a desired period, which minimize systematic side effects, improves the solubility of poorly soluble drugs. Furthermore, the encapsulation process has enhanced the stability and ultimately the overall viability of the therapeutic agent. Lactose spinning is not limited to one type of molecules. It is a highly suitable method for diverse range of active, including small molecules, sensitive proteins, and even herbal active surfacing. Its broad application in pharmaceutics, the basic lab setup is simple and typically requires for four main components: high voltage source and provide the necessary electric potential to change the polymer solution. Fiber morphology. Fiber morphology is determined by three main categories of factor: solution, process, and environment. Solution factor: how polymer solution itself impact the result. Setting of the equipment used, like applied voltage, material, flow rate, distance between the needle and the collider. Mention the external condition done the process, like temperature and humidity. The material used in this process can be broadly categorized: synthetic and natural. Synthetic means PLA, polyacetic acid, polylactic glycolic acid, polycarbolactin, polyvinyl alcohol, polyurethane, polyethylene glycol, etc. The natural polymers we can use, just like chitosan, gelatin, collagen, silk fiber, and its durability is depend upon the properties biodegradable, biocompatible, tunable, and degradable. Next slide, please. I'm audible.
Yes, ma'am.
Next, we are discussing the advanced achievement as with the core cell genus, axial fiber structure, protective sensitive axial fiber structure, protective sensitive biomolecules from degradations, and we are environment improving drug loading efficiency. Next. We can achieve both localized and delivery at expected stage over a desired period, which minimize synthetic side effects, improve the solubility and poorly soluble drugs. Furthermore, the encapsulation process helps enhance the stability and ultimately the overall viability of the therapeutic agent.
Thank you so much, ma'am.
Hello. Madam, are you audible to me?
Incomplete drug incorporation strategies, electrospinning, simple but may cause breast release. Immersion electrospinning protects bioactive molecules. Coaxial electrospinning force cell fibers for controlled release. Controlled drug release mechanism is divided into three steps: diffusion control, degradation control, stimuli response.
Hello.
Biomedical application we are discussing.
Madam, I am audible.
Audible? Yes,
Madam, am I audible?
yes, sir. Yes, sir.
Ma'am, I have one question that
Yes, sir.
Which drug you are using in multi-drug loading system, and what kind of diseases preferably you choose for your advanced fiber architectures?
Sir, we are using various polymers as a PLA, PLU, and PCL, or natural drugs we are like the same.
Okay, and susceptible diseases, if any, there, madam? Hello,
Targeted
ma'am. Susceptible diseases for multi-drug loading.
disease system and hello,
हाँ ma'am, I am listening, madam. You carry
sir. Once again,
on, madam.
yes.
Okay, thank you, madam. Thanks a lot.
Now I would like to invite Tushar Sharma.
Hello.
Yes, am I audible?
Hello.
Yes, I am sharing your slide.
Sir, am I audible? Hello.
Yes, you are audible.
Hello.
Yes, you are audible.
I'm audible?
Yes, you are audible.
Thank you, sir. Good afternoon to all of the distinguished scholars and the respected faculty members and the established industry professor. Before beginning my presentation, I would like to express my heartfelt gratitude for this wonderful opportunity to present my work before such an estimate audience. My name is Tushar Sharma, and I'm a final year BPharm student from Rajiv Academy for Pharmacy, Mathura. Today, I will be presenting on the topic of the 3D bioprinting, a molecular frontier in the therapeutic and the tissue engineering. As the title suggests, this topic involves the 3D bioprinting, which represents the groundbreaking intersection of the engineering, molecular biology, and the pharmacology. 3D bioprinting has a significant impact on the molecular pharmacology and the therapeutic science through the development of the molecularity defined tissue models, patient specific and regenerative, constant and precise medicines. Now look at the principles of the bioprinting. 3D bioprinting operates on the computer controlled layer by layer fabrication. Hello.
Yes, you are audible.
Okay, thank you, ma'am. It works on the layer by layer fabrication process that integrate the living cell with the biomaterials to create the functional biological structure. The workflow of the 3D bioprinting technically involves the three main stages: digital model designs, bioink preparation, layer by layer biodecomposition, and fourth and last, the post-processing tissue maturation. Now let's talk the classification of the 3D bioprinting. There are many tabs, but we are using mainly four tabs. Extensive based bioprinting. In this method, the mechanic a nozzle nozzle pumped the bio ink to create a 3D structure with a high cell density. Second is the inkjet bioprinting. In this technique works similarly to the conventional inkjet printing, where the droplets of the bio ink are precisely dropped on the substrate to build biological structure layer by layer. Third is laser assisted bioprinting. In this approach, a force laser beam used to transfer the tiny droplets of the bio ink on a receiving surface, offering the high accuracy and variability. Fourth is the photopolymerization based bioprinting, also known as the stereolithography. This technique uses a light, mainly uses UV light and visible light to solidify the photosensitive bio ink layer by layer by forming highly detailed and complex tissue structures. Now we come to the main part of our presentation, hybrid additive manufacturing. The hybrid additive manufacturing is the combination of the additive manufacturing and the conventional manufacturing techniques. This hybrid approach effectively overcome the limitation of the traditional bioprinting methods, such as the low mechanical strength, poor resolution, and limited biomaterial compatibility. It's offer a wide range of the advantages, includes enhanced mechanical strength, improved biofunctionals, and greater molecular precision. In the field of the molecular pharmacology, it relevance the extensive like drug tissue interaction study, control release kinetic, and a micro scale clinical implantation. Now let's discuss the molecular and the pharmacological implication of the 3D bioprinting. Let's start with the molecular implications of the bioprinting. First is the bridge biology and the pharmacology. It helps us to study the drug's behavior in the pharmacology relevant in the 3D environment by offering a more accurate understanding how to drug interact with the human tissues compared to the traditional 2D models. Second is the therapeutic implication. It enables the target drug delivery system support molecular level tissue regeneration, leading more effective and personalized treatment. Third is the molecular level in slides. 3D bioprinting facilities signal pathway map and mapping, gene expression profiling, protein and the receptor targeting, and the nanoparticles binding studies. Fourth is the integration with the sorry.
Your time is over. Can you please summarize in 1 or 2 minutes?
Sorry, ma'am. Can you repeat the question?
Your time is over. Can you please summarize in 1 or 2 minutes?
Sure, ma'am. Ma'am, there are 2 or 3 points left. Can I explain them?
Okay, you can continue.
Okay, thank you, ma'am. Now let's talk about the biomedical and therapeutic applications. We use 3D printing in the bone and the cartilage regeneration, vascular cartilage tissue engineering, and neuro tissue spinal cord repair. And sometimes also we can also use in the skin and the soft tissue regeneration. Despite now we are facing some limitation and the challenges like the biological challenges, material constraint, and the technical and engineering issues, and pharmacological and translational challenge. Now we have some future perspective of the 3D printing. First is the 4D bioprinting. Second is the integration with the nanotechnology. Third is the AI and the computerization of the bioprinting. Fourth is the personalized and precise therapy. Fifth is the translation and the clinical involvement. Sixth and last, the integration with the molecular pharmacology. That's all, ma'am. Thank you. Hello.
First, now we request sir to please ask the question. Tushar, I have one question.
Yes, sir.
Is there any
Yes, sir.
marketed drug which present that used or produced by your 3D printing mechanism?
Yes, sir. There are not many, but there are specific drugs which are currently using on a small scale, not approved by all the government bodies of the world, but in some specific cases we are using them.
So, do you know any one of them?
Right now, I don't know any of them names, but next time I will know.
Okay, thank you.
Thank you, sir. May I leave, sir?
Yes, you can. Thank you so much.
Thank you.
Now,
Thank you,
moving
ma'am.
forward, we would like to call Ayush Srivastav for his oral presentation. Sir, are we audible?
Yes, ma'am, I am audible.
Okay. Okay, you can continue.
Okay, thank you, ma'am. So firstly, very good afternoon to all the respected delegates and faculty members present here, and thank you all from the bottom of my heart to giving me this opportunity to present myself and on such a platform. First, now, I am Ayush Srivastav, a student of M.Pharm second year, Pharmacology branch from Rajim Academy for Pharmacy. Next, please. Okay. The topic which I am going to discuss today is the advancement in the treatment approach of insulin resistance by combining pharmacological as well as non-pharmacological approach. So here, firstly, I am going to discuss what is insulin resistance. Insulin resistance is that condition in which the pancreas are producing enough insulin, but the insulin is not going to work and done the process of glucose uptake in muscles and cells. Secondly, this insulin resistance feature is mainly predominantly found in the conditions like type 2 diabetes, obesity, and cardiovascular diseases due to inflammatory markers. The condition which is going to arise due to this insulin resistance is hyperinsulinemia and increased rise of glucose, that is hyperglycemia in blood. Next, please. The pathophysiology involved in insulin resistance is basically the insulin resistance is mainly found and observed in skeletal muscles, liver, and adipose tissue. And the mechanism which are included is impaired insulin receptor signaling, that is AMPK signaling pathways, chronic inflammation, oxidative stress, and due to the lipid accumulation and mitochondrial dysfunction in mainly muscles and liver. It results in increased glucose levels in the blood, that is hyperinsulinemia and hyperglycemia. Next, please. Now talking about the treatment approach in insulin resistance, which is widely found all over the world. The first line drug which is used in insulin resistance is metformin, which activates AMPK pathway, adenosine monophosphate protein kinase pathway, which basically improves insulin sensitivity. And it is the first line drug used in treatment of diabetes mellitus type 2 and insulin resistance. The other drug which is predominantly used is thiazolidine diones, of which the example is pioglitazone. What pioglitazone does is it increases glucose uptake in adipose tissue in case of obesity. Next, please. Now, there are other novel pharmacological therapies also, which are nowadays used along with metformin in some cases, like GLP-1 receptor agonist, of which the example is semaglutide. What semaglutide does is enhances insulin secretion and reduces appetite. If our appetite is reduced, we will take less calorie diet, thus less release of insulin is required. Second is SGLT2 inhibitors. The example of SGLT2 inhibitor is dapagliflozin and empagliflozin. What it does, it promotes renal glucose excretion. So the glucose level will go down in the blood, glucose excretion in urine. Next is dual GIP and GLP-1 agonist. The example is tirzepatide, and it works in various mechanisms. Last is AMPK activators. AMPK activators, which is metformin, which I have already discussed. Next, please. Okay. The thing which is less discussed is nutraceutical and role of natural compounds. The first line drug we use in insulin resistance is metformin. Other drugs we have also discussed. But the other thing which can also be combined in the treatment regimen is nutraceuticals, of which the most research compounds are berberine, which is found in Berberine vulgaris. How it works? It improves glucose metabolism and reduces inflammatory markers in body. Second is resveratrol. It is found in grape family and berry family. How it works? It enhances mitochondrial function. That's why it promotes or we can say it improves AMPK signaling, thus better insulin secretion. Third one is curcumin, the most researched one. It is a potent antioxidant and anti-inflammatory drug. So by combining nutraceuticals along with our pharmacological and non-pharmacological approach, we can enhance the therapy regimen. Next, please. Apart from that, the most important factor which causes metabolic disorders like hyperinsulinemia is lifestyle problems such as obesity. So what we can do? we can make personalized and trained exercise protocol for patient. Next, we can provide some personally tailored diets, which will be low calorie, high diet, high protein, high fat, but low calorie. Next, please. Apart from that, one emerging approach in treatment of insulin resistance is improving our gut microbiota, providing probiotics and prebiotics, restored gut flora balance. What it does? Hello,
Please summarize it in 1 or 2 minutes.
hello.
Am I audible?
Yes, sir. Yes, sir.
So your time is over. Please summarize your best topic in 1 or 2 minutes.
Okay, next, please. Next, please. Okay, should I summarize right now?
Yes.
So,
Yes.
Okay. By summarizing my topic, I want to say that the main approach when we treat a patient of insulin resistance or type 2 diabetes mellitus, we tend to give the first line drug, that is metformin, or in combination with other drugs. But if we combine the pharmacological, non-pharmacological probiotics, natural products, plus diet and lifestyle changes, the treatment regimen may increase the potential of treating the patient and reversing the type 2 diabetes mellitus. And it is the topic which I am going to research in my MPharm project. The combinative effects of pharmacological, non-pharmacological, diet lifestyle changes, and probiotics in management of insulin resistance. That is it, sir. Thank you.
Thank you, sir. Now I request dear sir to please ask the question.
Ayush,
Yes, sir.
I have one very basic question for you.
Yes, sir.
1 unit of insulin is responsible
Yes.
for the how much mg per dl of glucose?
What, sir?
1 unit of insulin
Yes, sir.
is responsible to lower the how much amount of glucose in the body.
Sorry, sir. I am not confirmed with the exact value.
Okay, thank you, Ayush.
Thank you, sir.
Thank you so much. Now I would like to invite Kaushal Patel for their poster presentation. Is Kaushal Patel is here with us?
Hello, sir. Am I audible?
Yes, you are audible. I am sharing the slide. Am I audible, sir?
Can I, sir? Can I
Yes.
start, sir?
Yes, sir, you can start.
Sir. Hello, sir, and hello, friends. Good afternoon. My name is Kausar Patel, and I am a first-year MPharm student of Ramanbhai Patel College of Pharmacy, Charusat University. And today I am here to present our work on the breast cancer, where we actually use a natural flavonoid for the treatment of the breast cancer. We are performing a computational study and in vitro study as well as dynamic study, molecular dynamic study. So basically, as we all know that breast cancer is most occurring cancer in a female, particularly in annually 2.3 million new cases are found, and every year 6 lakh, more than 6 lakh deaths are reporting due to the breast cancer. So in India, whatever the cancer is occurring in the female, out of 40% of the cancer is due to the breast cancer. So in the recent time, novel target or novel protein is responsible for the occurring of the breast cancer, which is identified as a TGF beta, which is nothing but transforming growth factor beta. Basically, having the dual nature, in the initial stage, this TGF beta is work as a tumor suppressants protein, but in later in stage, due to that changes in the morphology and changes in the functionality, it will convert into the tumor generative protein, and they will start producing breast cancer. So basically, for that, due to the paradoxical nature of the TGF beta particular target, we require the selective inhibitor for TGF beta so we can inhibit that signaling pathway, and we can reduce the chances of occurrence of the breast cancer. So basically, we are using here the natural flavonoids, which can be found in fruit, vegetables in abundant amount. So basically, they having the properties of the antioxidant, anti-inflammatory, and anti-cancer. Many of them are using, or they are proving that they can be having the anti-cancer activity. If you see the example of that, so like quercetin, genistein, epigenin, they camphor. So they all are having the flavonoid class of compound, nothing but the polyphenolic compound. So they're having the effect towards the anti-cancer. So when we do the literature review, we think that we can use this compound, and we can think that whether they are working on TGF beta target or not. So for that, we use molecular docking with the help of Schrödinger software, and then we use GROMAC software for the performing of the molecular dynamics. And based on that, whatever the compound we get, we go for the in vitro screening as well. So what the methodology, sir, later on, downside, sir. So what the methodology we use? So we use first of all we use preparation of protein. So for that we use 1py5 PDB-ID protein, and using the Schrödinger Maestro 10.4 software, we optimize the structure, and we remove the water molecules and add the hydrogen bond, and we proteinize the our protein at the pH of 7 plus or minus 2 for actual docking study. If we talk about ligand, so we use PubChem software, PubChem database for our ligand data, and we use leak prep for minimizing energy of the particular ligand and maintaining the stereochemistry, and they are using for the particular further docking study. Then, if we talk about docking, so we are using Client XP software, where we are using 30 by 30 by 30 Armstrong receptor grid we are set, and we doing the docking study, and we find out that which ligand having the maximum value, and then we out of that, if we see the result, so we get Gosipine having the highest minus 14.52 docking score as compared to the minus 9.2, the inbuilt ligand which is present in the protein. Then we select this compound gosipines for the molecular dynamic study. So where we use GROMAC 2022.6 software, where we use Solvity TIP 3P water box, and we are using the chloride ion for neutralizing particularly the boxes, and we performing the molecular dynamic study under the NVT and NPT condition. We particularly doing the dynamic study up to 100 nanosecond, and we find out the RMSD, RMSF, hydrogen bonding, and PCA matrix, particularly for the protein ligand compound. Then we go for the determination of ADMT profile. So from that we can identify that log p-value, Lipinski rules we follow for particularly identify that whether the compound can be druggable or not. And at last we perform that compound for the in vitro cytotoxicity study, where we use MCF breast care cell line, which we procure from the Pune, and we performing the cell line study, and we get the result. So now we see what the result we get. So at the end of the docking, we
Sir,
get the highest. Yes, sir.
so your time is over, sir. Please summarize it
Yes,
in
sir.
2 minutes.
Yeah, sure, sir. So based on the docking study and dynamic study, we get the very good stable protein and ligand. Ligand is nothing but the gossip in they having the good protein ligand binding capability, and the dynamic study also showing that these both compound having the stable complex formation, and they having the good hydrogen bonding as well as very less in fluctuation. And the thing is that, and if we last conclude that. If we go for the in vitro assay, it also showing the MTT assay when we performing the cell line study showing that good cell can be having the good response toward the gossiping, and they showing the good activity in particularly breast cancer. So they definitely can be in the future effect work. they can work as a novel anti-breast cancer therapy. Thank you, sir. Thank you.
Thank you so much, sir. Now I invite sir to please ask the question.
I have one question.
Yes, sir.
Do you calculate or calculate the possible or potential side effect of your biomolecular drug as an anti-cancer treatment?
Yes, sir.
What are the possible adverse effects of your drug?
Sir, I can't understand your question. Can you, sir, elaborate the questions?
I am asking you that your
Yes.
natural flavonoids having some potential side effect or adverse effect to the patient.
Sir, basically these flavonoids are easily available in the fruit, vegetables, and like that. So they are not more towards the side effect point of view. They are actually beneficial for us because having the antioxidant, anti-inflammatory effect in them, they naturally having that effect. So definitely they are the beneficial for the patient because if antioxidant, anti-inflammatory, anti-cancer activities are there, they can reducing the reactive oxygen species activity in the body, provide the beneficial immune response to the person, particularly if we talk the compound like quercetin, so the epigenin, so they have already proved the anti-cancer activity. So I think so they are the beneficial effect, more beneficial effect towards the patient.
Thank you so much, sir.
Thank you, sir. Thank you.
Now I would like to invite Ram Gopal Singh for his oral presentation. Is Ram Gopal Singh is with us? Am I audible? Is Ram Gopal Singh with us? Now I would like to invite Sarjana Raikwar for her oral presentation.
Excuse me. Hello.
Yes.
Sir, I have joined, sir. When will I present my presentation, sir? After this candidate?
Yes, sir. Yes, sir. After this.
Okay, sir. Okay.
Sir, good afternoon. I am Dr. Sarjana Raikwar. Sir, can you give me just 5 minutes? So after that, I will present.
No issue, sir. After Shivam Tyal, sir, you are ready?
Yes, sir.
Yes.
I'm presenting. I'm sharing my presentation, sir.
Yes,
Just
sir.
a minute. Just a second, sir. So is it visible, sir? Hello, sir. Is it visible? Presentation?
Yes, sir. Yes,
Okay,
sir.
sir. So shall I start, sir?
Yes, sir.
Okay, thank you. Very good afternoon to one and all. My name is Shivam Tyal. I'm an associate professor at the School of Pharmacy, ITM University Gwalior, and a research scholar at Amity Institute of Pharmacy, IIT Gwalior. This work I am presenting here under the supervision of Dr. Neeraj Mishra, sir, Professor, Amity Institute of Pharmacy, Amity Institute Gwalior. So my topic is advances in pharmacological therapies for inflammatory bowel disease, sir. This is my topic. So introduction. So what is inflammatory bowel disease? Actually, the inflammatory bowel disease are of two types, Crohn's disease and the ulcerative colitis. Sir, this is not a very short-term disease. It is a very long-term disease. This disease cannot be healed within a short span of time. It is a very long disease, and it makes the patient's life very uncomfortable. And the main symptoms of this disease is stomach pain, diarrhea, tiredness, and weight loss. So actually, this disease was very uncommon earlier into the world, but nowadays this disease is becoming very common day by day in the world. and it makes the patient's life it brings the it create a very big impact on the patient's life, and in some cases it also requires some surgery to relief from the this disease. As such, there is no exact cause of IBD is not known, but there are certain factors which actually aggravate this disease, and these certain factors are genes, means family history or inherited disease. Second factors which actually aggravate this disease is immune system problems. It can also be called as an autoimmune disease, because in this disease, our own immune system actually attacks the intestine. Third factor is the changes in the gut bacteria, the bacteria which is available in our gastrointestinal tract. Whenever there is changes occur in the gut bacteria, these diseases occur. And the fourth factor that can increase the chances of this disease is that the environmental factors, especially the diet, nowadays the diet, smoking, and the hygiene. If we are continuously being unhygienic, then this disease can be this disease may happen. I was talking about the gut bacteria, sir, and there is whenever some gut bacteria alterations takes place in our gastrointestinal tract, there may be a chances that this disease can be happen. And if there is some alteration changes in gut bacteria takes place, it can lead to an inflammatory bowel disease and irritable bowel syndrome, and in some cases there is a colorectal cancer can also be happen. So maintaining the good bacteria, good microbiota into the intestine, it is very important to prevent from this disease. So this is there is some bacteria microbiota which is available in our gastrointestinal tract, like in stomach and duodenum, Helicobacter and Streptococcus bacteria is available. In jejunum and ileum, Bacteroides, Streptococcus, Lactobacillus like bacteria is available, and in colon, Bacteroides, Prevotella, Roseburia, Clostridium like type of bacteria are available. So these bacteria should be available in our gastrointestinal tract, so that to get relief from this IBD disease. If there is any alteration takes place in this disease, it may cause the IBD in our body. So, as I said that the IBDs are of two types, that is the Crohn's disease and ulcerative colitis. What is the major difference between the Crohn's disease and ulcerative colitis? In Crohn's disease, basically Crohn's disease takes place usually in the small intestine and at the beginning of the large intestine. And the main, the characteristic features of this Crohn's disease is that in Crohn's disease, it actually affects the deeper layer of the bowel wall, while in the ulcerative colitis, it actually takes place in the large intestine, and it do not occur in the deep layers. It actually exists in the superficial layers. As you can see in the pictures in the Crohn's disease, the ulceration, the inflammation is actually taking place into the deep layers, while in the ulcerative colitis, you can see it is actually present in the superficial layers.
So your time is over.
Hello? Yes, sir?
So your time is over. Please summarize it in 1 or 2 minutes.
Okay, sir. Okay. Just give me 5 minutes, sir. I'm just summarizing. So let's go. Sorry.
You're already going out of time, so you are having
Sure, sir. Now I'm coming directly to the medication part, sir. There is basically it is divided into 3 medication parts. First is the conventional therapies. In conventional therapy, there is the aminosalicylates, corticosteroids, and immunomodulators. But these therapies actually do not work on the main cause of the disease. It actually relieves from the symptoms. Next is the biological therapies, which is nowadays it is very helpful and it is very beneficial to because it works on the main cause of the disease, that is the anti-tumor necrosis factor alpha agents, anti-integrin, anti-adhesion molecules, and interleukin inhibitors. Nowadays, also after these biological therapies, now novel agents are also come into the market, like the Janus kinase JAK inhibitors, sphingosine 1-phosphate, and other new targets. These are the probiotic also. Probiotic is also very helpful in treating there's IBD. This is the complete probiotic action in the IBD, which how it prevents the IBD in our body. So these are the possible treatment of the IBD, like the modification of the oral microbiota, diet and nutritional therapy. And these are some biological drugs which are useful, which are helpful in treating the IBD. So these are some challenges, these actually therapies are very very costly, and there are certain side effects are also available. So what in today's scenario, personalized medicine is very required. Thank you so much, and thank you so much to the administration, to the authority of the MIT University for giving me this opportunity to showcase my work. Thank you so much.
Thank you, sir. Now I would like to request sir to please ask the question.
Shivam?
Yes, sir.
I have basically two questions for you. My first question is that can you clinically differentiate between the ulcerative colitis and the piles?
Ulcerative colitis and sir?
Piles.
Piles. Yes, sir. Sir, actually, there is a difference between ulcerative colitis and piles. In piles, what happened that there is a hemorrhages that takes place into the anus part and the rectum part. While in the ulcerative colitis, if ulcerative colitis are become very severe, then in that cases the chances of the fistula are happen. But in the ulcerative colitis, it is not compulsorily that the piles takes place. So there is a difference. In severe cases, ulcerative colitis can become the piles, but it is not compulsorily become the piles. And the in the piles, it's an entirely different thing. In piles, there is a takes place of the hemorrhages takes place, sir. There is a major difference, sir.
Okay. The second question is for you that is there any psychological connection between the inflammatory bowel syndrome and the ulcerative colitis?
There is a psychological impact on the sir.
Are they involving
in IBD, sir?
IBD or inflammatory ulcerative colitis also?
Sir, yes, sir. You can say that there is a psychological effect on the IBD, sir, but not that much because, sir, actually the IBD, the reason of the IBD is actually entirely different. It is actually immune response, and it is a genetic effect. Yes, there might be a psychological effect, sir. I'm not I'm मना नहीं कर रहा हूँ, but there can, but it is the chances of psychological effect is very less, sir. But yes, sir, if by the positive attitude, by the positive mentality, this disease can be cured, sir.
Okay, thank you.
Thank you. Thank you so much, sir.
Thank you so much, sir. So please close your screen.
Yes, sir. Just a minute, sir. Oh, just a minute, sir. Yes. Sir, sharing is stopped, sir. I have stopped sharing, sir.
Yes, sir. Yes, sir.
Sir, should I stay or can I leave, sir?
Yes, sir. You can leave, sir.
Okay. Thank you so much, sir.
Am I audible, sir?
Yes.
Am I audible?
Yes, ma'am. You are audible. Ma'am, please share your screen.
Yes, sir. Yes, sir. Just a minute.
Ma'am, you have 4 minutes to please.
Is it visible, sir?
Yes, ma'am. Yes, ma'am.
So very good afternoon to one and all. I am Dr. Sarjana Rekwar. Today I am here to present my work on Trastuzumab functionalized Chitosan nanoparticle loaded with 5-fluorouracil and carboplatin for targeted HER2 positive breast cancer. There is a different types of breast cancers like triple negative type, HER2 types. HER is a human epidermal growth factor receptor, which is especially overexpressed on the breast cancer cell. So why the targeted nanoparticles? There is a reason for the targeted nanoparticle. Nanoparticle precise the delivery of therapeutic agent directly to the cancer cells, dramatically reducing off-target effect and minimizing the damage to the healthy tissues throughout the body. And targeted functionalization using monoclonal antibody, which antibody directly target to HER2 receptor through receptor-mediated endocytosis, it delivered the drug content. Third one is the biocompatible carrier. As we use chitosan, chitosan is a biodegradable, biocompatible natural polymer derived from chitin, so which is used for the development of nanoparticles. Dual drug targeting. In the present project, the two drugs were taken, 5-fluorouracil and carboplatin. 5-fluorouracil is an anti-cancer drug which directly disrupting the DNA synthesis and preventing the cancer cell replications. Second one is a carboplatin, which is a platinum-based drug which causing the irreversible DNA cross-linking, triggering the apoptosis and blocking the cell cycle progression. So the combined effect shows the synergistic, like 5-fluorouracil and carboplatin both shows synergistic effect in the cancer cell death. Engineered and the engineered nanoparticles. So the preparation method includes chitosan nanoparticles synthesized by ionic chelation techniques, where sodium triphenyl phosphate as a cross-linker, ensuring the uniform particle size distributions and colloidal stability. Here, both drug carboplatin and 5-fluorouracil loaded. So firstly, 5-FU dissolved in water and stirred until completely dissolved. This drug solution above drug solution acetic acid and added to the solution at pH 4 to 5. Afterward, chitosan of the medium molecular weight was stirred in the above solution, and further the above solution in 10 mg of PEG 6000 also added to enhance the solubility and stability. And after continuous stirring, then carboplatin was added and stirred until it completely dissolved into it. Finally, the 5-fluorouracil loaded chitosan solution was placed in a homogenizer, and the carboplatin loaded sodium TPP solution was added drop-wise, and using syringe and nanoparticles were formed. The surface modification of these nanoparticles were performed using trastuzumab, that is monoclonal antibody. After the formation of nanoparticle, after the formation of nanoparticles, functionalization takes place. Then optimization using design of expert. Here, the design expert software used and Vox-Beacon design were chosen. Three-factor, three-label design I chose, where first 3D surface plot shows the particle size ABC for the particle size determination, and second one is D for the zeta potential, E and F for the entrapment efficiency of 5-FU, and G and H for the entrapment efficiency of carboplatin. Characterization of chitosan nanoparticle, including the particle size, zeta potential, and PDI. So the final conjugated nanoparticle was found to around 248 nanometer in size and PDI 0.375, zeta potential of about plus 18.2 due to the positive charge of chitosan. Third C diagram shows the transmission electron microscopy of the functionalized nanoparticles. The in vitro drug release study performed at 2 pH 5.5 and 7.4. So the maximum drug release was found at pH 5.5, which indicate that the functionalized nanoparticle shows the maximum drug release at acidic pH. Next is the cellular uptake study of chitosan nanoparticles, where the flow cytometry study shows the maximum uptake of the trastuzumab conjugated nanoparticles in SKBR3 cells. These SKBR3 cells shows the overexpression of HER2 receptor. So the trastuzumab, the main mechanism behind this, the trastuzumab directly conjugated to the SKBR cells, which overexpress HER2 receptor, and through receptor mediated endocytosis, it shows the maximum cell uptake.
Excuse me, time is over.
Yeah, ma'am.
Wind up in 1 or 2 minutes.
Yeah. The last one is the in vivo cell uptake, in vivo study. In vivo study performed in a Swiss albino mice, where the the diagram shows the in vivo pharmacodynamic activities of both nanoparticles, unconjugated and conjugated. The excised tumor bearing mice after the 13th day of the tumor inductions. So A is the EAC control, the second B is for the drug solution, third one C is for the normal unconjugated liposome, and fourth D is for the final conjugated nanoparticles. Sorry. And the E, F, and G shows G is showing the average number of tumor cells after post therapy, and H for the percentage tumor inhibitions of different group after post therapy. At last conclusion, the present study successfully developed, optimized, and characterized the transdermal conjugated drug-loaded nanoparticles for the effective breast cancer treatment. The nanoparticles were assessed based on the particle size, zeta potential, PDI, and entrapment efficiency and drug content. So antibody conjugation performed using NHS and EDC, and followed further characterization including the transmission electron microscopy, in vitro drug release, ex vivo study, and in vivo studies in EAC model. So future for cancer treatment, this approach exemplifies the future and personalized targeted cancer treatment with tremendous potential to overcome the current therapeutic limitation and improve the patient outcomes. Thank you so much.
Now I would like to sir to ask some questions.
Madam, I have one question for you.
Yes, sir.
What are the possible side effects of your chitosan nanoparticles like drugs?
Sir, possible side effects like sometimes, yeah.
Yes. Okay, yes.
Yeah. So in case of chitosan nanoparticles, sometimes it may be, it may cause the RES uptake may be possible if the nanocarrier have more than 200 nanometer size, because RES uptake is not for the below 200 nanometer size of any nanocarrier. So there is a possibility of that. But in case of this is the nanoparticle functionalized with antibody, so this is a type of active targeting.
Okay, so before your study, do you check the acute oral toxicity dose of the chitosan nanoparticles?
Sir, can you repeat the question?
My question is that, do you confirm or try to find out the oral acute toxicity dose of your chitosan nanoparticles?
No, sir, because the nanoparticle given intravenously, so I cannot find the oral toxicity. But I also perform some parameter for hepatotoxicity and nephrotoxicity, where the blood sample of these mice were performed for the SGPT and SGOT determinations, where the transdermal conjugated nanoparticles shows minimum level as we compare with the control group, so it is equal to the control. Yes, so no, the biomarker level is not down and not high in case of transdermal conjugated nanoparticles.
Well, I just want to know that which kind of OECD guideline for toxicity screening you have chosen?
For toxicity study?
There is some OECD guidelines.
Yes, sir. Sir, I am not clear.
Thank you. Thank you.
Thank you so much, sir. Thank you, sir.
Thank you so much, ma'am. Now moving on, I would like to call Ram Gopal Singh for his oral presentation. Sir, is Ram Gopal Singh with us?
Ram Gopal Singh, sir. Now I would like to invite Divya Verma ma'am for her oral presentation.
Hello.
Yes, ma'am.
Good afternoon, everyone.
Yes,
I
please.
am Divya Verma, a BPharm final year student from Bundelkhand University, Jhansi.
Ma'am, please share your screen.
Yes, 1 minute. So, I will be presenting on ligand-based targeted drug delivery in chemotherapy. As we all know, cancer is a chronic disease and it remains one of the leading cause of death worldwide. And while traditional treatment like chemotherapy, radiation, immunotherapy, uh, they kill cancer cells, but they also harm healthy cells. And this causes severe side effect and systemic toxicity. So this is where the concept of transdermal drug delivery comes to play. Unlike traditional method, transdermal drug delivery aim to direct therapeutic agent precisely to the tumor cells using ligand. This is a treatment that reduces harm to normal cells and tissues and improve treatment efficacy and safety. So now the question arises, why ligand? So the targeting ligands are the molecule that can recognize and bind specifically to the receptors. Cancer cells have overexpress receptor because they need nutrition in a high quantity. So these ligands bind to those receptors and they either trigger tumor cells directly or they deliver therapeutic agent to the cancer cells. This system significantly enhances therapeutic efficacy while reducing systemic toxicity. In recent several years, targeting ligand including folic acid, carbohydrate, peptides, aptamers, and antibodies have been utilized. So first is folic acid mediated targeting. Folic acid is a small molecule vitamins which transport through a receptor mediated endocytosis using folate receptor. This folate receptor is expressed at low level in normal tissues, but it is overexpressed in a variety of cancer cells, including breast, ovarian, endometrial, lungs, neck, etc. So it act in two ways. First is folate drug conjugate. In this, the amino group of pteridine folate linked to the small molecule drug through chemical bonds such as amide, ester, and then they deliver drug to the targeting cell. Second is folate conjugated nanoparticles. In this, the drug is carried by the nanocarriers like liposomes and nanoparticles, etc. And then it is delivered to the targeting cells. Carbohydrate mediated targeting. So the cancer cells have cancer cells need high quantity of glucose for their growth. So carbohydrate like glucose, galactose, and hyaluronic acid can easily attach to drug carriers and bind to specific cell receptors. Many tumor cells overexpressed specific carbohydrate binding receptor such as mannose receptor and CD44 receptor or GLUT4 receptor. This approach increases drug accumulation in tumor, reduces side effect on healthy tissues. Again, there are two ways of delivering drug. First is carbohydrate drug conjugate and second is carbohydrate conjugated nanoparticles. They have the same concept of delivering drug.
Ma'am, your time is about to up. Can you please summarize in 1 or 2 minutes?
Yes, ma'am. Next is peptide mediated targeting. Peptide mediated targeting use small specific peptide ligand to deliver drug directly to the cancer cells. Aptamer mediated targeting. This targeting method uses short single standard DNA and RNA molecules called aptamer to deliver drugs specifically to the cancer cells. The best thing is that there is 3D shape are available. The 3D shape, what does they do? They are highly specific and have high affinity towards cancer cells and have a wide range of targeting. So they act like a chemical antibodies. Next is antibody mediated targeting. Antigen presents in cancer cells. Now the antibody drug conjugate, the drug bind to the antibody and deliver toxin specifically to the target cells. Antibody detect cancer cells and immune cells like NK cells. Now, what are the challenges? Because ligand are very small molecule. Their manufacturing process is very difficult.
Excuse me, ma'am.
Yes, ma'am.
Your time is up.
Okay, ma'am.
Would like to call sir to ask you a few questions.
Yes, ma'am.
Can you tell me which kind of targeted type of medication is more efficient? Whatever you have listed here.
Sir, there is no single more efficient type. According to me, there is antibody mediated targeting is more efficient. I found it.
Any reason behind that?
Yes, because cancer cells have a high amount of antigens, and the antibody easily detect them, and they also send signals to like immune cells, NK cells, and macrophages to kill cancer cells specifically.
Thank you.
Thank you, sir.
Thank you so much, ma'am. Now, moving forward, we would like to call Ram Gopal Singh for his oral presentation. Sir, are we audible?
Yes, ma'am.
Okay, you can continue.
Okay, good afternoon to all. I am Ram Gopal Singh. I am a PhD scholar. So this is my research topic and formulation and physicochemical characterization of rizatriptan benzoate sublingual granule. Next, ma'am. So what is the need for the rapid onset in migraine treatment? So firstly, we have to introduce from this topic. I am working on the triptans, that is the rizatriptan, and second one is we are treating for I am treating for the migraine. So many patients are working like a office and the daily activity, so suffer from the migraine, acute migraine like this. So that's why I'm also suffering from this disease. So I have chosen that topic from my PhD. So I have to for the rapid onset of in migraine treatment. First one is the acute pain relief. When we are taking a oral administration by tablet, so that there is no effect. There is a specific effect, or we can say that fast relief we cannot get from the tablet. So that's why we are preparing a sublingual. So delayed treatment, oral medication take 30 to 60 minutes. So that's why we are preparing a sublingual granules. Early interventions, most effective when administered at the onset of migraine symptoms, adherence and compliances also. And the critical window is that if the medicines work quickly, migraine does not progress to the stage of the nausea and vomiting. If we are taking a drug before before the we have to feel that the symptoms we feel. So before that, we have to take that drug so that we can avoid the nausea and vomiting. Next slide, please. These are the objectives where I am working on this topic. First one is a characterization difference listed drug. I have taken the rizatriptan difference drug, that is a tablet. So I have taken, and we have studied on that topic, that physicochemical parameters like hardness test and etc. Now, second one is the select excipients. I have selected the excipients that are compatible with the rizatriptan benzoate. Third one is the develop formulation. We have to develop the triptans to enhance the efficacy. And the fourth one is the develop and optimize the method preparation, multi-particulate delivery system. We have choose the granules method because there is a availability of the chemicals and the facilities. So according to that, I have chosen the granulation method. That is the weight granulation method. Then we will go for the conduct the physiochemical characterization, evaluate the drug acid dissolution and stability of the developed formulations. Now we are going for to develop the stability indicating and to develop method analysis stabilis and the fourth degradation study. Next, ma'am. Now, what is the challenges in tryptase delivery? Solubility issue, firstly. In this tryptase category drug, that is a first treatment and first tryptane of the world. That is a sumatriptan, have poor solubility, delay absorption, and reduced bioavailability. And there is a other problem, that is the first pass metabolism. If we are taking a oral drug, so by orally, so we have a poor bioavailability. So these all are the challenges.
Your time is about to
Next
up.
slide is next slide. Next slide, please, ma'am. Next slide. We have formulated with the help of the excipients. First one, we have to take a tryptane, that is a rizatriptan benzoate. And second excipients, we have to take mannitol, and third one is the starch. I'm using starch as a binder also, and I'm using as a disintegrants. So the starch paste using as a binder, and the starch normally used as a disintegrants. So this is the excipients compatibility study we have to already perform. This is the development method. So we have formulated the granules by in my laboratories with the help of wet granulation method. Next one is this is the simple method which I have procedure. This is the procedure. So this is the procedure. Firstly, we have to take the weight, the drug, and excipients and pass from the 60 number sieves, mix the isgenian pestle and mortar, and we have to prepare gel and add into the mixtures. And we have to prepare the weight granules to pass from the 20 number sieves for the specific and the granules size. So we place the in a hot air oven for the drying process.
Rangopalji, can you please listen
And
to me?
जी sir.
Your time is over, है ना? Now conclude this in 1 minute.
Okay, sir. Okay, sir. This is the all. This is all about the which I have prepared. Firstly, मैं आपको बताना चाहूंगा जो मैंने granules बनाए हैं वो sublingual granules बनाए हैं rizatriptan benzoate के, जो कि onset of actions migraine से treat करेगा, जो कि अभी तक नहीं बने हैं triptans के, जो कि मेरा ये PhD का टॉपिक है. और इस मैथ से जो लोग सफर कर रहे हैं, जो माइग्रेन से पीड़ित हैं, वो जल्दी ट्रीट हो सकेंगे. और जो इसका डिसइंटीग्रेशन जो टाइम उसके अकॉर्डिंग 10 to 15 सेकेंड्स में इसका सॉलिडिटी आ जाती है और सबलिंगुअली, तो जिससे कि कंप्लायंसेस भी बढ़ेंगी और ट्रीटमेंट भी अच्छा होगा. ये ऑल ओवर कंक्लूजन था सर मेरी स्टडी का.
ओके राम गोपाल जी, आई हैव वन क्वेश्चन. अभी आपने प्री क्लिनिकल
जी सर.
इन्वेस्टिगेशन नहीं किया फॉर्मुलेशन का, है ना? डू यू हैव एनी प्री क्लिनिकल
जी
डेटा
सर.
फॉर्मुलेशन?
No, sir. I have no any clinical data. I have just take a reference drug, that is a rizatriptan tablet. So
okay, thank you.
This because of this I'm not taking any of the data. I'm just doing a research and take this topic and prepare a sublingually granules. But before that, oral film and tablets already prepared in the market, but granules not prepared.
Thank you, sir. Thank you.
Okay, sir.
Yes. Now we'd like to invite Prerna Singh. Is Prerna Singh with us? Am I audible? Is Prerna Singh is with us?
Hello.
Yes, ma'am. Yes, ma'am.
Hello.
Yes, ma'am. Please share your slide. Ma'am, am I audible? Excuse me, ma'am. Ma'am, am I audible?
Yes, 1 minute.
Sir, is the slide visible on screen? Mute, take your mic.
Ma'am, you are having only 4 minutes.
Good afternoon, everyone. I am Prerna Singh from Bundelkhand University, Jhansi, a B.Pharm 4th year student. Today, I will be presenting on the topic Recent Advances in Nanotherapeutics for Neurological Disorders. Have you ever wondered why treating brain diseases like Alzheimer's or Parkinson's is so difficult, even with all our medical advancement? The main reason lies in the blood-brain barrier. This is a protective shield that blocks the most drugs from reaching the brain. But what if we could send medicines directly to the damaged neurons, precisely where they are needed? That's where the nanotherapeutics comes in. These are the tiny, smart drug carriers are revolutionizing how we approach neurodegenerative diseases, offering target drug delivery for better stability and improved patient outcomes. Firstly, we will be know what are neurodegenerative disorders. These are the diseases where nerve cells in the brain and spinal cord gradually lose functions and dies. This damage is a progressive, irreversible, and leading to memory loss, movement problems, and cognitive decline. And there is many types of these diseases: Alzheimer's disease, Parkinson's disease, and multiple sclerosis. What are the challenges in traditional therapeutics? Drugs in this, the drugs cannot cross the blood-brain barrier effectively and has low drug concentration at the target site and systemic side effects due to the non-specific drugs. And only small amount of medicines reaches the brain, and the poor stability and bioavailability of short drug half-life. This is why we need nanotherapeutics. Nanoparticles are small sized, 1 to 100 nanometer, and can cross blood-brain barrier and reach brain tissue effectively. Liposomes. Liposomes are the spherical vesicles made of one or more phospholipid bilayers similar to the natural membrane. इसके हम लोग और मेथड्स जानेंगे कि ये कैसे बाइंड करता है ब्रेन रिसेप्टर्स में से। इसका फर्स्ट स्टेप होता है सरफेस फंक्शनलाइजेशन, फिर ये बाइंडिंग करता है रिसेप्टर के साथ ब्लड ब्रेन बैरियर में, तब ये ट्रांसपोर्टेशन करता है ब्लड ब्रेन बैरियर के अक्रॉस, फिर बाइंडिंग करता है ये टारगेट न्यूरॉन्स के साथ या ग्लियल सेल्स के साथ, फिर ये ड्रग रिलीज करता है ब्लड ब्रेन बैरियर में, जिससे कि हमको थेरेपेटिक इफेक्ट प्रोवाइड होता है। Dendrimers. These are the highly branched tree-like polymeric nanocarriers and have a core branch layers and a surface shell with functional groups, and the size range is 2 to 10 nanometers. इसका एग्जाम्पल है PAM-AM dendrimers, useful in glioblastoma and neuroinflammation. इसके भी कुछ ऐसे स्टेप्स हैं, पहले कोर फॉर्मेशन करता है, फिर ड्रग अटैचमेंट, एंड देन सरफेस फंक्शनलाइजेशन, फिर ब्लड ब्रेन बैरियर क्रॉसिंग, फिर ये कंट्रोल्ड रिलीज करेगा ड्रग का, और तब हमको थेरेपेटिक इफेक्ट प्रोवाइड होगा। And then we move to magnetic nanoparticles in nanotherapeutics. Magnetic nanoparticles are supramagnetic materials used for target drug delivery and imaging. These are made of iron oxide guided by the external magnetic field to a specific brain region, enables site-specific drug delivery, allows MRI imaging of same region. This is called the theranostics. This is used for brain tumors, stroke, and neuroinflammation. And the hyperthermia therapy is also given in this technique. Then we move to exosomes. Exosomes are nano-sized extracellular vesicles naturally released by the stem cells, neurons, or macrophages.
Ma'am,
In this, the
Can you please summarize in 1 or 2 minutes?
Yeah, ma'am. Nanogels are tiny water-absorbing polymer networks that can encapsulate drugs. These are biodegradable, biocompatible, and deliver drugs through the multiple routes like intranasal. This is nose to brain route. This bypasses the bloodstream. And examples in this are insulin, piperine, and Alzheimer's and Parkinson's also. Mechanism of this is the drug encapsulation. Active drug is trapped in nanogel matrix. Administration is nanogels via olfactory and trigeminal pathways to reach the brain. And these emerging therapies in nanotherapeutics are gene therapy using nanocarriers. This is to correct defective genes, and siRNA and miRNA for silencing disease-causing proteins, and stem cells-derived exosomes for neuron repairing, smart nanogels for respond to pH or temperature for controlled release. Thernostic nanoplatforms are for gold and iron nanoparticles, performs both imaging and treatment simultaneously. Conclusion is nanotechnology offers innovative solutions for the treatment of neurological and neurodegenerative disorders by overcoming the blood-brain barrier. Emerging nanotherapies like CRISPR gene editing and siRNA delivery and exosome-based delivery are shaping in the future of personalized brain medicine. These approaches combine therapy and diagnostic, improving diseases detection and treatment precision. And the final remark is nanotherapeutics represent the next generation medicines, bridging technology and neurosciences complex brain disorders safely and effectively. Thank you, sir.
Now we'd like to call Sir to ask you some questions.
Can you tell me about the toxicological concern of these nanotherapeutics materials? And what about the toxicity that they produce
The
inside?
toxicity.
Are they better or not? With compare the conventional drug therapies, these nanoparticles or nanotherapies are good as far as concerned with the toxicity. What do you think about that?
So these also causes toxicity, but these are good.
Okay, thank you.
Thank you so much, ma'am. Now you can leave.